Have you ever experienced numbness or tingling in your hand after long hours of computer use? Today we're exploring a common condition that could be the culprit: carpal tunnel syndrome. Often affecting gamers and those who spend a significant amount of time on computers, this syndrome is more than just a temporary discomfort. In the next few minutes we'll break down its definition, causes, symptoms, and treatments. So, let's dive into what this carpal tunnel syndrome really is. Carpal tunnel syndrome, or CTS, is essentially the compression of the median nerve at the level of the flexor retinuculum. It's a condition that arises when there's too much pressure on your wrist's median nerve. This nerve, which runs from the forearm into the palm of the hand, can cause numbness, weakness, and sometimes even pain in the hand and fingers. It's different from the pronator teres syndrome, which also affects the median nerve but at a different location. So that's what it is. But what causes it? The primary cause of carpal tunnel syndrome, or CTS for short, is actually idiopathic, meaning we don't exactly know why it happens. But there are known secondary causes. These include space-occupying lesions like tumors, hypertrophic synovial tissue, fracture callus, and osteophytes. Metabolic and physiological conditions like pregnancy, hypothyroidism, acromegaly, and rheumatoid arthritis can also be culprits. Infections, neuropathies associated with diabetes or alcoholism, as well as certain familial disorders have been linked to CTS. And then there's a common factor many of us can relate to: job or hobby-related repetitive trauma. Yeah, that's right, your gaming marathons or long hours of coding could be taking a toll, especially if there's forced wrist flexion involved. As for who gets it, well, it's more common in females. In fact, the female-to-male ratio is 4:1, making CTS the most common entrapment neuropathy. Now that we know what causes it, let's look at the symptoms. The symptoms of carpal tunnel syndrome, or CTS, can be quite distinct. The sensory loss primarily affects the radial 3.5 digits, which are the thumb, index, middle, and half of the ring finger. These are the areas where the median nerve provides sensation. Often the first thing people notice is a loss of discriminative touch, but it doesn't stop there. Imagine being abruptly awakened at night by a numb or painful hand. The only relief comes from shaking, dangling, or rubbing the hand. As the condition progresses, you may notice a decrease in light touch sensitivity and two-point discrimination, especially at the fingertips. In advanced cases, there could be thin-arm wasting or weakness. Two clinical signs often associated with CTS are Tinel's sign, a tingling sensation when the nerve is tapped, and Phelan's sign, where wrist flexion induces symptoms. Although it's primarily a clinical diagnosis, nerve conduction velocity and electromyography tests can confirm it but not exclude it. So we've identified and diagnosed CTS, but how do we treat it? The treatment for carpal tunnel syndrome varies based on the severity of the condition. The first line of defense is usually conservative, which involves avoiding repetitive wrist and hand motion. Wrist splints can be used when repetitive motion is unavoidable, particularly at night, to keep the wrist in a neutral position. Medical interventions may also be used, such as non-steroidal anti-inflammatory drugs, local corticosteroid injections, and even oral corticosteroids. However, in more severe cases, surgical decompression may be necessary. This involves a transverse carpal ligament incision to decompress the median nerve. Indications for surgery typically include numbness and tingling leading to sensory loss, weakness leading to muscle atrophy, and unresponsiveness to conservative measures. But like all surgeries, it's not without its risks. Complications can include injury to the median motor branch, local pain, and even scar formation. Remember, prevention is better than cure, so make sure to take frequent breaks when you're gaming or working on your computer. Before we wrap up, we have a small request. If you found this video helpful and want to keep learning about interesting and challenging topics like this, please consider subscribing to our channel and joining our community. Don't forget to give this video a thumbs up if you found it interesting and helpful. Your support helps us continue to produce high-quality videos that make complex topics easy to understand. Thank you for your support.